Cayuga Centers, Community Organization or Agency Assessment by Brittany Winans and Brittany Fulkowski. To develop our macro assessment skills, we have chosen the organization Cayuga Centers to focus on for our project.
Who is Cayuga Centers? Cayuga Centers is dedicated to empowering children and families through a variety of services, including counseling, foster care, and support programs. Originally established in Central New York, the organization now extends and reaches across multiple states, prioritizing the needs of families. As a registered 501 C3 nonprofit, Cayuga Centers focus on social services and sustains its operation through combination of donations, grants, and often collaborating with government agencies with specific initiatives. The organization began its journey in 1852 as an orphanage in Auburn, New York, with the primary mission of providing a safe haven for vulnerable children.
Leadership. Cayuga Centers is currently guided by its Leadership Council, a dynamic and diverse team composed of 18 professionals who share a strong commitment to the organization's mission. Under the leadership of President and CEO Edward Myers Hayes, the Leadership Council oversees executive decision-making for the agency.
For our interview, we interviewed Cindy Pagan, who is the Vice President of Behavioral Health. This interview revealed both strengths and challenges that Cayuga Centers faces. This is where she dedicated over 20 years of service. One of the notable strengths highlighted is the expansion of evidence-based programs. This progress has enabled Cayuga Centers to extend its research across multiple counties in New York State and expands its presence across various locations on the East Coast. Additionally, the organization is highly regarded for its supports of children and families within the community. Cayuga Centers has established a strong reputation for fostering trust with both local communities and partnering agencies. Cayuga Centers is predominantly provider for community services. This faces several significant challenges. One major obstacle is funding. As a private nonprofit organization, Cayuga Centers depends on government contracts, grants, and Medicaid building. This reliance can be problematic, particularly when it lacks contracts in certain communities and limits the services they can provide. Another significant challenge is staff retention. The agency invests considerable resources in hiring and training new staff employees for specific evidence-based models. Unfortunately, many staff members tend to leave shortly after a few months, leading to this continuous cycle of training and resulting in staffing shortages that restricts service availability. Looking forward, Cayuga Centers aims to expand its program and supports for families further. While growing is currently due on hold due to financial constraints, there is still potential to overcome these challenges and create a promising future.
Impact. Upon examining the implications of these two problem areas more closely, it becomes clear where the agency should focus its efforts to initiate change. Funding challenges act as obstacles to expanding programs into currently underserved areas, limiting the number of clients that can be served. Service areas are constrained by existing contracts, which restrict client resources. Additionally, the cost barrier for clients who may not be able to afford coverage further complicates the situation, particularly those who cannot benefit from a sliding pay scale. The consequences of poor staff retention include increased caseload for existing employees, a diminished capacity to serve clients due to workforce shortages, and the insufficient use of limited resources on hiring, onboarding, and training personnel who do not remain with the agency. This situation can ultimately result in missed grants and other funding opportunities due to its ineffective resource management.
Some of the solutions we came up for these issues are by conducting a thorough internal financial audit focused on the agency's spending, especially hiring, onboarding, and training. This analysis will offer insights into the financial allocations and identified areas of optimizing funding. By leveraging this data driven approach, we aim to enhance resources distribution efficiently and ensuring every dollar spent effectively supports our organizational goals and workforce development. Introducing an anonymous survey of current employees to assess job satisfaction and evaluate salary levels would be an effective starting point for addressing these staff retention issues. If there are underlying policies or cultural problems within the agency, a survey can help identify the specific areas affecting the employee's retention. The automaticity of the survey will encourage to be honest feedback and allow employees to express their views without fear of retaliation. With this information in hand, we can begin to redesign our hiring, onboard, and training processes by analyzing financial data and soliciting input from staff. We will identify the areas that are required for improvement and optimize it. Finally, once the new program is developed, we will implement leadership training to ensure the new policy is effectively integrated throughout the agency.
Risk versus reward, a new hiring and training program. Risk factors. Revisiting current hiring and training practices involves moderate intensity, as it requires significant effort to redesign these processes. However, ongoing management should be less challenging once the changes are made. Evaluating salaries may also present a moderate intensity, especially given an already constrained budget. In contrast, changing negative staff attitudes towards these changes represents the highest level of intensity, as it will require a collective effort from the entire organization to design and implement these modifications effectively. Motivational factors. On the other hand, the motivating factors for this change include the potential reduction of time needed to train new employees, which would allow staff to concentrate more effectively on their caseloads. Additionally, reducing the resources allocated to hiring and onboarding could alleviate the strain on a tight budget. Ultimately, enhanced staff satisfaction will positively impact the families we serve, as improved employee morale correlates with better outcomes for clients. In the long run, minimizing the time, resources, and costs associated with training holds a high intensity rating, as the agency can recover losses and reallocate crucial resources. The improvement of both staff and client satisfaction carries a moderately high intensity rating, indicating the significant motivation for change among employees and management.
The 7-step process of evaluation. Identify the problems. The interviews revealed that funding and staff poor retention, exacerbated by training and billing demands, we need to improve onboarding and training processes to enhance staff retention efficiently. The review of macro and personal reality. Social workers face significant workloads impacting their capacity to train new staff and assist clients. High turnover hinders client supports and may lead to missed grant opportunities. Inflation raises questions whether wages are competitive enough. Establish primary goal. The goal includes redesigning hiring practices, onboarding and training programs, and implementing leadership training. Identify influential people. Key stakeholders include Leadership Council, President CEO, Edward Meyer Hayes, staff, clients, and government representatives. Assess financial costs and benefits. Analyze loss from poor retention and explore more efficient funding allocations. Improvements will benefit happier, better trained social workers with manageable caseloads and enhance client service and staff satisfaction. Risk review. Redesigning hiring and training will require significant effort, but should ease ongoing management. Evaluating salaries is moderately intensive due to the budget constraints, while shifting negative staff altitudes poses the highest challenge. Lastly, evaluate potential change. Motivating factors include reduced training hours, which allow staff to focus on caseloads. Improvement in employees' morale and client outcomes are expected, leading to better resources allocation and long-term agency recovery.
Thank you for watching our presentation. Below are listed our citations,